Previously, we have talked about vitamin B5, that's pantothenic acid. Right, in this video, we are going to talk about vitamin B6, also known as pyridoxine. Right, this vitamin is very important. You need to pay attention, please. Right, because we'll mainly talk about general characteristics, function, deficiency, toxicity, and we'll conclude by talking about therapeutic uses, right? Okay, therapeutic uses is not clear there. Right, so let's start with general characteristics. The active form is pyridoxal phosphate, or PLP in short. What are the sources of this vitamin? The sources include nuts, whole grains, vegetables, yeast, and meat like liver and poultry. Just examples, right? What about resorption, right? First stage after eating these foods containing this vitamin B6, the first stage is cleavage by phosphorylases and subsequent resorption by the intestines. Let's talk about transport. Transport in blood is two ways. Like, firstly, it's partially free and partially bound to albumin. Albumin is a very important transport protein. Right. Let's talk about the functions of this vitamin. Right. So pyridoxal phosphate, or PLP, is a coenzyme for the following reactions. Right. Transamination, that's the first one. This one is aspartate transaminase and alanine transaminase. These are just examples. It's also a coenzyme in decarboxylation, amino acid metabolism, and also glycogen phosphorylase, right? So this one is an enzyme for glycogenolysis, that's destruction of, why am I saying destruction? Okay, breaking down of glycogen into glucose, right? So it's also a coenzyme in neurotransmitter synthesis. Which neurotransmitters? Neurotransmitters like serotonin, dopamine, epinephrine, norepinephrine, or gamma aminobutyric acid, also known as GABA, right? Okay, so that's the functions of vitamin B6. Right, let's talk about deficiency, right? Deficiency of vitamin B6. What causes this deficiency? So the main causes include malnutrition, heavy drinking. Heavy drinking is important here. Chronic renal failure, chronic hepatitis. Right, and another important cause is drug interaction, mainly isoniazids and oral contraceptives. Right, so if you are taking these drugs, you need to supplement with vitamin B6. Right, isoniazid is a drug for tuberculosis. Right, so every time you prescribe isoniazid, you should also prescribe vitamin B6. Right, so these are the causes. Right, what are the clinical features of vitamin B6 deficiency? Right, so they include the following: chelosis, glossitis, stomatitis. Right, so if you remember, these symptoms are also symptoms of riboflavin deficiency. Right, so that's why I said it's very important to know the causes, the history of the patient. The second feature is sideroblastic anemia, right? Because vitamin B6 deficiency causes heme synthesis dysfunction with impaired transfer of iron to hemoglobin, which ultimately leads to iron accumulation in red blood cells, right? So you just need to know like your general pathways from methyl malonyl CoA. Methyl malonyl CoA can be converted to succinyl CoA, right? And succinyl CoA, in the presence of vitamin B6, will be converted to heme and porphyrins, right? So you just remember that pathway for this anemia, right? And also the other features include irritability, seizure, and peripheral neuropathy, right? So these are the clinical features. Okay, Now let's talk about the second part, which is toxicity, right? So toxicity happens if there is over-supplementation of vitamin B6, right? What are the clinical features which show toxicity of vitamin B6? They include dizziness, nausea, peripheral neuropathy, dermatosis, and photosensitivity, right? So these are the features of vitamin B6 toxicity. All right. So to conclude this video, let's talk about therapeutic uses. Right. What are the therapeutic uses of vitamin B6? As I told you, the first one, let's talk about tuberculosis. You need to administer pyridoxine to prevent isoniazid-induced peripheral neuropathy. Right. That's the first thing. And the second thing is like in hyperemesis gravidarum. Okay, so this is a condition when a pregnant woman is having persistent and severe nausea and vomiting, right? You can also use vitamin B6 in this case. Thank you so much. If you like this video, please make sure you subscribe so that you won't miss any of our latest videos. Thank you so much. Head bowed.